What is OSA? If you have obstructive sleep apnea, your breathing pauses for periods of various length and frequency while you sleep. This causes the level of oxygen in the blood to drop, often significantly below normal levels. Over a period of time, this oxygen deprivation damages your body's systems, causing the associated conditions or making them worse. Normally, when you breathe in, air flows in through your mouth and nose and down your throat, also called the pharynx. Air then flows down your windpipe or trachea, spreading through a tree-like structure of small tubes into your lungs. Each time you breathe in, negative suction pressure pulls the soft tissues in your mouth and pharynx inward. The muscles in your pharynx respond by pulling the soft tissues outward again, which keeps your airway open. When you sleep, it's normal for the muscles in your mouth, tongue, and pharynx to relax slightly, but not enough to block your airway. If you have obstructive sleep apnea, the muscles of your mouth and pharynx may relax too much. Your tongue drops onto the soft tissue in the roof of your mouth, pressing it against the back of your throat. This can partially block the airflow into the lungs, called a hypopnea. Or it can completely block the flow of air into your lungs, called an apnea. As your body starves for oxygen, you gasp for air. Your brain continues to send a signal telling you to breathe, and eventually you create enough negative pressure to force air past the obstruction. OSA is a cycle of events. After the onset of sleep, the muscles in the airway relax. The obstruction occurs, blocking the airway. Oxygen decreases and carbon dioxide increases. You struggle to breathe until you consciously or unconsciously relieve the obstruction. Breathing resumes and your oxygen and carbon dioxide levels improve, and you resume sleep. In severe patients, this cycle happens 30 or more times per hour. Many factors can contribute to obstructive sleep apnea, but there are no hard and fast rules. Some include weight or body mass index, because increased weight causes more fat to be present in the walls of the pharynx. A small or receding lower jaw with a narrowed airway. Loss of muscle tone in your pharynx due to aging. And far less frequently, swollen tonsils. Common symptoms of obstructive sleep apnea are observed cessation of breathing during sleep, awakening while gasping for air, snoring, chronic daytime sleepiness, frequent nighttime urination, morning headaches, fatigue, irritability, and impaired concentration. OSA is diagnosed with a sleep test, which also determines the severity. If you have described symptoms of OSA to your doctor, or he believes you are at risk based on a wellness screening program, he will prescribe a sleep test and diagnosis from a certified sleep specialist. If you've heard horrible stories about the expense and inconvenience of staying overnight in a sleep lab, don't worry. ProAct's modern technology enables your sleep test to be completed in the comfort of your own bed, hassle-free, with a home sleep test device mailed to your home. Home sleep testing is well recognized as an alternative to lab-based testing. The American Academy of Sleep Medicine guidelines state that home sleep testing should be used when there is a high pretest probability of obstructive sleep apnea, and all studies should be read and interpreted by a board-certified sleep physician. ProAct's screening protocols identify probable OSA with over 90% accuracy, and tests are always interpreted by a certified sleep physician. The severity of the disease is determined by the number of apneas and hypopneas per hour throughout the night. This measurement is defined as the apnea-hypopnea index, or AHI. An AHI less than 5 is normal. AHI of 5 to 15 is mild, AHI 16 to 30 is moderate, and AHI over 30 is considered severe. The diagnosing sleep specialist also considers other parameters measured during the sleep test, including heart rate and the number of times the patient's blood oxygen levels drop, and the amount of time blood oxygen levels reach critically low levels. Oral appliance therapy and continuous positive air pressure, better known as CPAP, account for 99% of the treatments. There are various types of surgeries, but they're risky, quite painful, very expensive, and involve considerable recovery times. Success rates with soft tissue surgery vary, but they are low. There are a few devices under development, but most are still experimental. Oral devices are worn on the upper and lower teeth during sleep. The device moves the lower jaw or mandible forward, thereby keeping the airway open, allowing you to breathe normally. These oral appliances are often referred to as mandibular advancement devices, or MADs. There are numerous manufacturers of oral appliance therapy devices. The Quality Management Committee of ProAct's accredited health network has developed strict criteria for testing appliances, including durability, patient comfort, effectiveness in moving the jaw forward, ease of adjustment, and clinical validation. At this time, the ProAct Health Network uses one device exclusively because our tests have shown that it excels in these areas, uniquely including a 3-year warranty. Oral appliance therapy is well-recognized therapy by the American Academy of Sleep Medicine. Their guidelines state oral appliances are indicated for use in mild or moderate obstructive sleep apnea patients who prefer an oral device to CPAP, and for severe patients after they have tried and failed CPAP. Patients with mild to moderate OSA represent approximately 75% of patients, and oral appliance therapy is indicated as the first course of treatment. If you are one of those diagnosed as severe, a continuous positive airway pressure device, or CPAP, is typically recommended. This machine pumps air through a tube into a mask that fits over your nose or both your nose and mouth. The mild air pressure of the CPAP machine helps keep your airway open, enabling you to get deep, restful sleep. However, a substantial portion of patients cannot tolerate their CPAP. If this proves to be the case, the American Academy of Sleep Medicine recommends oral appliance therapy be prescribed by your doctor because some therapy is essential. If you would like more information about obstructive sleep apnea, ask your doctor or visit ProActHealthSolutions.com. Thank you.